Swadika, thank you very much for joining us for the evening edition of NBT World Brief right here on NBT and NBT World. I'm Cholapansan Rula. The Ministry of Foreign Affairs held a press conference on the recent clashes between Thai and Cambodian troops, which resulted in one fatality and several injuries. MFA spokesperson Nikonde Phalangoon stated that Foreign Minister Sihasak Phuangketkaew briefed Foreign Diplomatic Corps, emphasizing that Cambodia violated the ceasefire agreement signed in October in Kuala Lumpur. The military operation is mandatory to protect sovereignty. Thai military actions will continue until Cambodia shows sincerity in de-escalating tensions. The spokesperson detailed the timeline of the clash, noting Cambodia fired BM-21 rockets into a Thai civilian area, prompting a proportionate Thai air defense response due to risks from landmines. Thailand's stance remains. Only military targets are engaged, and military actions will continue until safety is assured. The Thai government condemns Cambodia at the highest level for firing artillery into Thai territory, harming civilians and causing casualties amongst military personnel. The minister highlighted that Cambodian attacks again affected civilians, forcing evacuations and hospital closures. The minister criticized Cambodia's lack of responsibility, using misinformation tactics and fabricated facts without evidence. Cambodia portrays itself as the victim, using old footage and state agencies to accuse Thailand of starting the conflict. The spokesperson urged the public and media to follow only verified information from official channels. Regarding the joint declaration on de-escalation, the spokesperson said, Thailand is not in a position to answer. Cambodia must clarify its intentions, as it has violated every point in the agreement.
The current situation once again shows Cambodia's repeated tactics by starting the conflict first, then denied its own actions, including continued provocation such as planting of new landmines. Cambodia tried to portray the image of calling for peace and restraint, but did the opposite. Our military action will continue until Thailand's sovereignty and territorial integrity are not being compromised. Based on the latest report, the Cambodian side has fired rockets from BM-21 multiple rocket launches into civilian areas in Thailand. I note that some particular international media outlets have chosen to headline that Thailand has launched airstrikes into Cambodia. The reason why Thailand had to launch the airstrike is due to the geographical terrain that is full of landmines. We have no choice.
Prime Minister Anutin Charnvirakul issued a formal statement earlier today addressing armed clashes along the Thai-Cambodian border, assuring residents in affected areas that security agencies have been ordered to act decisively to protect national sovereignty and safeguard public safety. The statement followed incidents reported since yesterday that prompted evacuations and an expanded military response. The Prime Minister said Thailand's defense actions follow international law and humanitarian principles, and the country seeks peaceful relations with all neighbours. The government has no desire for conflict, but must act when threats endanger citizens or violate territorial boundaries. Military units have been instructed to operate under established rules of engagement while protecting civilians. Government agencies have been ordered to support evacuees with safe shelter, food, drinking water, medical services, and welfare assistance. To ensure accurate information reaches the public, the Prime Minister assigned the Ministry of Defence and Ministry of Foreign Affairs as the main sources of verified updates. Authorities said all relevant units are tracking developments and reporting them clearly to prevent confusion and limit misinformation. In addition, the Prime Minister directed governors in 7 border provinces to intensify civilian protection, relocate at-risk communities to safe zones, and ensure evacuation centres provide consistent care. He underscored the need for uninterrupted budget allocation so residents do not face shortages of food, medicine or essential goods. The Premier also called for stronger cooperation in securing rear areas by integrating local administrative units, village protection teams, and the Volunteer Defense Corps, saying these zones are crucial for supporting frontline personnel. Hospitals in the region have been told to heighten readiness for potential casualties, maintain adequate blood reserves, and deploy mobile medical units to serve displaced residents. Authorities across Thailand's eastern border provinces are accelerating security operations and civilian protection measures as tensions with Cambodia escalate. In Buriram, Governor Piya Pichanam said that province is preparing evacuation systems, reinforcing temporary shelters, and deploying expanded patrols. Local administrative teams, village leaders, territorial defense volunteers, and village security units are conducting continuous surveillance to safeguard residents and monitor emerging risks. In neighbouring Sakao province, the situation has grown more serious following reports from the Burapha task force. Surveillance has detected ongoing movement of troops, equipment, and heavy weapons from the Cambodian side towards the border. Task force officials reported additional advances this morning, raising concerns about threats to Thai sovereignty and the safety of communities living in frontier areas. These developments were seemed inconsistent with the existing peace agreement between Thailand and Cambodia. In response, the Burapha Task Force launched military operations to re-establish control over Thai territory along the Sakao border zone. Sakao authorities have issued evacuation orders for residents in 4 border districts, namely Ta Phaya, Kok Soong, Aranya Pratet, and Klong Hat. Temporary shelters have been set up with essential supplies including food, drinking water, and hygiene items. Public health teams are stationed on site to assist children, seniors, and individuals requiring medical attention. Healthcare services in high-risk areas have also been adjusted. The Sakao Provincial Public Health Office announced the temporary closure of inpatient and outpatient services at Ta Phaya Hospital, Kok Soong Hospital, Aranya Pratet, and Klong Hat hospitals starting December 8th. Emergency and accident departments remain operational 24 hours a day for critical cases. Thai military officials have confirmed an increasingly volatile situation along the Thai-Cambodian border following a series of Cambodian attacks that escalated at daybreak. Major General Winthai Suwari, spokesperson for the Royal Thai Army, reported that Thai forces are acting under a defensive response plan and are engaging only military targets that pose direct threats to national security. Intelligence assessments show heightened military activity from the Cambodian side, including increased troop deployment, expanded equipment reserves, and additional support weapons. The Thai Army has also identified a rising risk of long-range weapons being directed deeper into Thai territory. Areas near Buriram Airport and a hospital in Prasat district that's located as far as 30 kilometers from the border have been flagged as potentially vulnerable. Preparations have been made to counter these developments. Clashes intensified in the early morning across multiple locations. Cambodian forces employed small arms and artillery, resulting in Thai casualties. Fighting was reported in Chongbok, while further evidence confirmed Cambodian offences in Chong An Ma, Hoi Ta Maria, and the Kana area, which is near Prasat Tamuan. Thailand responded under its established contingency plan. Initial reports confirmed 1 Thai soldier killed, another unconfirmed, and between 7 and 8 injured. The army stated that suppressing support weapons has become necessary because previous attacks involved weapons directed at both Thai civilians and military personnel, causing significant harm. Officials reaffirmed that Thai forces remain fully prepared and continue to respond proportionately in accordance with international standards as the situation evolves. Surin Province is urging residents to support emergency preparedness as Surin Hospital calls for increased blood donations while several local hospitals temporarily adjust or suspend services. The appeal comes amid shifting operational capacities across the provincial medical network, prompting officials to inform the public of available care options and emergency contacts. The Surin Provincial Public Health Office reported updated facility statuses as of 9 a.m. today. Phnom Dong Rak Chalerm Praket 80th Anniversary Hospital is closed. Skapchung Hospital is also closed, affecting all departments. Prasad Hospital remains open only for emergency care, while Burchade Hospital continues to serve outpatients but cannot admit inpatients. Sangkla Hospital maintains full operations and remains the main service point for routine medical needs. Residents requiring urgent medical assistance are advised to contact hotline 1669, which operates around the clock. To strengthen the province's emergency response, Surin Hospital is appealing for blood donors to help maintain adequate reserves. Donations are accepted daily at the blood bank on the second floor of the pathology building from 8:30 a.m. to 6 p.m. Donors are required to bring their national ID card. Hospital staff have expressed readiness to support an expected increase in donors as the community responds to the call. Additional information is available at 044 511 757, extension 17202. And that wraps up our evening edition of NBT World Brief. Do stay updated with the latest developments right here on NBT and NBT World. For more stories, simply scan the QR code on your screen to access our full coverage across all media platforms. I'm Cholapan Sanarula. Thank you so much for joining us. Swadee ka.